Hi guys, Dr. Dan Nightingale here, your clinical dementia specialist. I hope you're having a great day. The sun's shining. I hope the sun's shining in your world too. This video, the therapeutic use of doll therapy. Now, dolls in dementia care have been used for a long time. You know, back in the day, back in early 2000, I was using dolls as doll therapy with my patients back then. The therapeutic use of doll therapy, what is it all about? How does it benefit people? And what are the kind of outcomes from it? Because sometimes it was seen as being infantilism. It was seen as being very babyish, you know, this grown adult, this 82-year-old lady having a doll, carrying a doll around with her, or carrying a teddy bear around with her. What is that all about? Because looking in from the outside, it would look very childish and why are we doing this to people? But it's all about attachment. Human beings need attachment. We need attachment to each other as much as we need food, as much as we need medicine, as much as we need vitamins. You know, we need attachment. And very often, that as somebody gets older, their world starts to shrink and the attachment becomes less and more distant. And especially when somebody moves into a care setting, whether it's a nursing home, whether it's a memory care community, assisted living, the detachments become less and less. So the value of doll therapy increases that attachment, and it also improves overall well-being. And I'm going to give you an example of a patient that I had back in the UK a number of years ago. This lady would wake up in the night and she would start opening cupboard doors, emptying drawers, throwing drawers on the ground, banging on doors, and nobody could understand why she was doing it. She wasn't vocal. She had no verbalization skills. So there was no way being asking her and trying to ascertain what it is. So they would call me, the nursing staff called me and said, this lady is doing this. Do you think we need to give her some kind of medication? Or what is it we can do? So my response was, of course, I'll tell you what we can do. We can find out why she's doing that. Why is she behaving like that? What's going on in her world to make that happen? You know, does she have a chest infection? No. Does she have a UTI? No. Does she have any health issues? No. Then we don't need medication, do we? Let's take a humanistic approach. Let's observe, let's monitor, and let's look into her life story. You know, life story work is a big thing now. Back then, you could sit down with nursing staff and ask about this lady, and they could tell you all about her health, but nothing about her. So we dig into her life story and we discover that when she was 19, her baby died. So what I assumed was she has gone back to this time and got stuck in this time frame. She's lost baby. So in the middle of the night, she wakes up and she tries to find baby. And she's looking in cupboards and she's emptying drawers, but she can't find baby. She's very distressed, so she's banging on doors and windows and things. So we tried this little strategy. We put a cot, or for the American viewers, a crib, in her bedroom and put a doll inside the crib. In the night, she woke up and she's searching and she sees baby in the crib. And she took hold of baby, got back into bed and went to sleep. And over a very, very short space of time, and I mean less than a week here, that behaviour was completely diminished. It had gone. So we always need to think and look at what the actual situation is, where are the triggers, what is the life history, what is the story behind this behavior before we say, okay, let's give them some medication. So that's what I wanted to talk about. And I have a number of publications out there. And one of the publications, I was looking through the journals today to find maybe what we were going to talk about. And I came across this article that I wrote, and I have the photograph of my life. This is the greatest picture I have ever taken. I was very fortunate because I was actually in that nursing home at the time that this was happening. And you are going to see the lady, you're going to see her friend, and you're going to see two special interactions. So Lynn is going to hold that up and show you the picture that I am referring to. Okay. Now you'd see the lady, you saw her holding the baby, you saw her with her friend, and you also see a donkey.
A donkey?
A donkey.
In an assisted living?
No, in a nursing home.
Nursing home.
In Kidderminster, in England. And the nursing home was called Nightingale something. It's a long time ago, I forget now. But it was called Nightingale. Nothing to do with me. I didn't own it. It wasn't mine. It was just one of the nursing homes that I looked after in the UK. And that was so special, because what we see there is a prime example of well-being. It's fantastic. There she is, enjoying, I think they were having some fruit or some sandwiches or something with her friend and baby and the donkey, which would come in once a week into the home and go around and visit patients and make a difference to their lives. So doll therapy is absolutely crucial. It is something that needs to be thought about. It's got to be planned. It's got to be structured. It's not just a matter of putting half a dozen or a dozen dolls around the home so that they can, pick up. It's not about that. It's about an individualized, person-centered care plan and ensuring that we're doing it for that individual's benefit. Now, this lady, I have two stories here. This lady would not let the doctor, if any doctor visited the home, she wouldn't let them leave until they checked baby to see if baby was okay. Secondly, a new gentleman moved into the nursing home. And this is on the very same day that I managed to capture that picture. And he was standing at the back of the living room, the back of the lounge, and he was just watching. And then he leaned on the piano in the lounge, in the living room, and he said, "What the hell is a donkey doing in my house?" It was such a funny, it was great. And when I came across that article, it just brought back all those fantastic memories. And today, in 2024, we're using more robotic type animals. So we're seeing, cats and dogs that sleep and that breathe.
They're toys, but they're lifelike toys.
Well, they're specifically made for people living with dementia type disease, illness. So that happens. So it's important that the message here is about attachment. It's really about how we as human beings need attachment and how we benefit from attachment. So isolation, we've talked about how damaging isolation is. So we must never isolate people. We must bring people together and enjoy interaction and engagement. And Lynn is burning to ask a question here. Yes. Or make a comment.
Comments, questions. So maybe this is an idea you could use at home with your loved one. Doesn't have to be necessarily in a formalized setting, but you could try that, especially if you obviously know the backstory of your loved one. I wonder about the open-mindedness of staff, of doctors, of family members. I just wonder, let's say this lady has a doctor's appointment, when she's going to the doctor's appointment and she wants to take this doll everywhere, and people are gonna be, the first thought is, that's not a real baby. Why are you talking to that baby? You know what I'm saying? A stigma of it's back to the thing of where people are always correcting people when they have a form of dementia, and how that's not correct to do that, to overcorrect people and things like that. So what's been your experience with staff members, doctors, family members? Are they open? Are they...
In the very early stages, there was controversy.
There was what?
Controversy. I don't know how American people say that word, but controversy, about it infantilely, making people look like babies and children, and of course they're adults. So there was some issues around that in the early days, but now in 2024, it's kind of an accepted therapy. It's a kind of an accepted intervention. It's an accepted thing to be doing. So this is why these videos are so important, because it's all about education. Education. And the more we educate the world, the better it is for everyone. Because had somebody walked past that nursing home and looked through the window and seen what we see in that picture, I don't know what they would think. They must have think, that's crazy. That's just crazy and ridiculous and stupid. But when you understand the meaning behind it, and you understand what it's all about, and you understand the necessity of attachment in the human race, we are socialized people. We have to be in groups. We are herd animals, just like horses. We need to be together, and we have to have attachment. And when that dementia kicks in and the journey progresses, then the detachment becomes less and less, and the world becomes smaller and smaller. So just having that attachment, and it doesn't have to be a doll. It could be a cuddly toy, it could be a teddy bear. For me, it would probably be a cuddly horse thing,
Monkey.
Or a monkey, yeah, because I love monkeys. So, one of those things. So it's about education, Lynn. It's about when people understand the meaning behind it and why it is done, then it becomes acceptable and embraced. And over the years, it has become more and more embraced. But it was very challenging at the beginning.
Right.
Good point.
Right. And the whole point, person-centered care, is really the central theme of every video, isn't it?
Absolutely. Yes, it is. It's all about true person-centered care.
And meeting a person where they are, where they're at. And I wondered, sometimes people talk to photographs that are in the journey of dementia, and they might think that the photograph is somebody they know, but it isn't, or those kind of things. Is that another reason that a person is having detachment problems or issues, is because they live alone, they talk to a photo, they carry it everywhere, a doll therapy in that situation could be a good idea. Yeah. I mean, it could be, again, here we have a situation that could have a number of explanations. If I'm talking to a photograph, why am I doing that? Is it a form of attachment, or am I experiencing some paranoia? Am I experiencing some mental health issue as part of my journey? So all that needs to be evaluated before we determine why. I mean, I talk to photographs, and I don't think I'm being paranoid when I do it. I just talk to whoever, if it's a picture of my mother, or if it's a picture of friends that have passed. Right.
I might say, I hope you're watching this. I hope you're proud of me here.
Also, you do quite a few house calls, which is a rarity these days. And I've come with you to some of these house calls, and I've met a lot of your patients, if not all of them. And a lot of these people live at home, but they have a pet, don't they?
Mm-hmm. Yeah.
Or even in a independent living, part of a bigger care community.
Mm-hmm.
But a lot of these people have a pet, a cat, or a dog, or something like that.
Pet therapy is, for me, one of the greatest things. One of the greatest privileges for me is to be able to interact with my pets. The dog, the cats, the horses, the chickens, the pig. We've done a video on our ranch here and how important animals are. Not everybody enjoys pets. Not everybody has that same thing. I know some of my patients who have no interest in pets. They couldn't even tell you what a domestic pet looks like, So there are people that don't have that need or that craving, but the majority of people do. And pet therapy is just absolutely amazing. We've done almost 80 videos now, so I'm not sure whether I've done an actual video on the benefits of working with horses and things like that. I know there's a paragraph there's a chapter in my book about ranch and farm therapy, but maybe we need to do a whole video on that, Lynn. Yeah, okay. Good.
Okay, so doll therapy, and the other point I want to make about having a pet, if you're able to take care of the pet and take care of yourself, is that would play into lifestyle of walking and exercising. If it's a dog, obviously you'll be walking and exercising, and it's mutually beneficial.
Or if you're trying to herd cats, that's very good exercise.
If you're trying to collect a cat, yeah. All right, very good.
Okay, well, thank you guys. Thanks for tuning in. I know this video will have been useful for you. Any questions, please direct them to me at drdanielnightingale.com, or ask me on this channel, or make a comment. I'm on Facebook, Instagram, all the social media platforms you can find me on. So have a fantastic rest of the day. Enjoy the rest of the week. And remember, guys, say it with me, dump the soda.